We need to know what are the clinical features or what are the symptoms of a person who is having lumbar canal stenosis and nerve compression. Usual and the most commonest symptom is the back pain when they have a lumbar canal stenosis. This is due to the compression of the nerves and irritation of the coverings around the nerves. However, if there's a nerve compression, the symptoms vary. The symptoms start to appear in the legs where the lumbar nerves supplies. If a nerve in the lower part of the lumbar canal is compressed, usually the pain goes down the leg to the foot, either on the right side or on the left side. That depends on the nerve that is being compressed. If a nerve in the right side is compressed, the pain goes down the leg. If the last nerve that is coming out of the lumbar spine is compressed, usually the pain goes into the buttock, to the thigh, as well as to the calf, and sometimes patients can get pain down to the sole. In addition to the pain, the affected muscles can sometimes get weak. The commonest thing that we see is a foot drop, where patients cannot raise the foot off the ground and the toes cannot be lifted against the ground. This is a serious problem, and if this foot drop appears, people should get immediate medical attention. Sometimes the calf muscles can get wasted. Out of all these things, a thing called neurogenic claudication is the common symptom that we see. In neurogenic claudication, people walk a little, they get a cramping pain in the thighs, buttocks and the calves. Once they sit down, they improve. Usually these kind of symptoms can come when there's a vascular compression also. However, in neurogenic claudication, when there's a nerve compression, people can't walk but they can cycle. When they are cycling, they won't feel the pain like that. This is a small feature that we can differentiate these two conditions, and once the neurogenic claudication is there, decompression of the nerves can give very good results. Now, these are the common motor and sensory symptoms that we get, but we have to remember that there can be bladder and bowel symptoms also, especially in compressions with acute discs in a canal stenosis. Background can lead to injury to the nerves that supply the bladder and the bowel. Then patients either get incontinent or sometimes get a retention of urine where they cannot pass urine. The bowel involvement is also a similar condition that would alarm the clinician to intervene. If you get either bladder or bowel incontinence, it is very, very important to decompress the nerves within a period of at least 24 hours. Earlier the better. At the same time, if you have a foot drop or any muscle weakness as a result of either lumbar canal stenosis or disc prolapse, it is very important to do the operation and release the nerves within either 24 hours